the concept of having proof and of being really, really sure in healthcare that something is going to work. Healthcare loves to do pilots. They like to test, but like you don't see too many things really get to scale. Can you talk about why that is?
Yeah, I mean, I agree that healthcare loves pilots. Like a decade ago, I wrote an article for KQED that was like death by pilot because I just saw so many healthcare startups do pilots that would go nowhere and waste the time. I wouldn't say healthcare hates scale. It's definitely challenging to scale, but it took scale for the incumbents to get as much power as they have today, especially health plans, pharmacy benefits managers, but certainly from like the provider side, it's very fragmented. It's very regional. I think the problem is that we often confuse proof of concept with proof of impact. And then we never do like the hard work of operationalizing the scale. And a lot of people say, we have an implementation problem, not an innovation problem in healthcare. The problem isn't that we don't have tools that are helpful, but that we don't have a way to implement them and we don't have teams to implement them broadly. Evidence certainly matters in healthcare more than industries because human lives are at stake and the downside risk is much bigger. In healthcare, the first most famous principle in the Hippocratic Oath is first do no harm. So there's, reasonable caution when trying new things, but it's led to a culture of not trying anything and kind of just accepting the status quo when we really need to change things. The path we're on is not sustainable.